Connected by purpose, driven by passion. This is Children's Healthcare Canada's Spark Live webinar series.
Children's Healthcare Canada would like to thank our Keystone funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live weekly webinar series. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box and be visible to all of the attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark Bulletin by visiting our website at childhealthcan.ca.
Hello everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. I'm Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin Anishinaabe people. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community, our province, and the country. Today, we're delighted to bring you Exploring Structural Inequities in Early Child Development and Intervention with Indigenous Families and Children and Advancing Trauma and Violence-Informed Care. Now, I'd like to introduce our speakers for today. Diana Elliott is a provincial advisor at the Aboriginal Infant Development Program of British Columbia. Diana is a Coast Salish from Cowichan tribes in Duncan, BC, and the Nuu-chah-nulth from Hoopa-chest-ulth First Nation in Port Alberni, BC. Diana has been in her current role as provincial advisor to 55 Aboriginal infant development programs for 17 years. Dr. Alison Gerlich is an assistant professor in the School of Child and Youth Care at the University of Victoria. She's a first-generation white settler of English and Welsh descent who is privileged to live and work on the unceded traditional territory of the Coast Salish peoples for the past 30 years. And Jason Gordon is the provincial advocate at the British Columbia Association of Child Development and Intervention. Jason is a fourth-generation white settler privileged to live, work, and play on the traditional unceded territory of the Syilx Okanagan Nation. Just a reminder that we record all our webinars. As mentioned in the introductory video, please type your questions into the question box at any time, and I'll prompt you via the chat as well. And I'll pose your questions to our guests following the presentations. It's now my pleasure to pass the mic to Diana.
Good morning, everyone, or Ait Squale or Ait Native, I would say in my home territory of Cowichan tribes. As mentioned, I'm Diana Elliott, and I'm happy to be with you here today with my colleagues. Thank you for the land acknowledgement that you did for us, and I will also like to do a land acknowledgement just to acknowledge every participant on this call today, whether you're in your home office or your agency office, acknowledging the territory where you work, live, and play today and every day. And in light of the news recently about the 215 children's remains that were found at the Kamloops Indian Residential School, doing a land acknowledgement, I want to acknowledge those children who never made it home who were taken from their traditional territory and their families and never made it back home. So our topic today, the intentions for this webinar are really to, in my mind, I'm going to add the honoring of those young children. And I'm also going to, I think it also helps us understand today what's happening when we talk about trauma-informed practice and trauma or violence-informed care. There's going to be so much more meaning now as nations come together to honor our children and sing them home to their creator, and also join in the healing journeys every time wounds are opened up again. So the intention of our webinar today is to talk about that shift in the care that we provide, how the structural inequities maintain the status quo of intervention systems for Indigenous communities, families, and children, and hopefully be proactive and practical in equity-oriented opportunities for change. And we do need system change in the ECDI world that can advance trauma and violence-informed practice with Indigenous communities, families, and children. So we hope you enjoy the sessions, and we look forward to engaging and answering questions when we're done. Haichka.
Thank you, Diana, for those words. And it's a privilege to be presenting with you and Jason this morning. So to get us started, I just thought I would, okay, I'm having problems advancing now. That didn't happen before. Okay. So key principles. In the increasing amount of literature on trauma-informed care, there are some recurring principles that I thought might be helpful just to orient us. So there's an awareness of the prevalence of trauma and its multifaceted impacts, sometimes intergenerationally, on children and adults' physical and mental health, behavior, and life trajectories. In the context of Indigenous families, this includes an understanding of how historical and, as Diana spoke to, ongoing forms of colonial oppression can create chronic stress and trauma. Trauma-informed care also primarily involves avoiding traumatizing through the provision of care. This may be done, obviously, inadvertently, but we want to ensure that that does not happen. In this approach, there's an emphasis on spending time to create safe and trusting relationships and creating spaces of comfort and belonging. And there's an emphasis on creating opportunities for choice and authentic collaborative relationships and processes of care. And this approach is implicitly strengths-based and free of judgment. So in our research that we're going to share with you today, we draw on this concept of trauma and violence-informed care, or TVIC, which expands beyond understanding trauma as an individual experience and draws attention to structural forms of violence that are often beyond an individual's immediate environment and or control. So structures and social mechanisms, and there's some examples on the slide here, constitute forms of structural violence when they cause harm, deny human rights, constrain human agency, and or prevent individuals and population groups from having the resources necessary to help them reach their full potential, while sparing other groups from the same treatment. Our research focused on the system, as Diana mentioned, of early child development and intervention in BC. And in this system, we're including children's rehabilitation or early intervention therapy services, so occupational therapy, speech-language pathology, and physiotherapy. And we're also including Indigenous-specific and mainstream early intervention programs, which in BC includes the Infant Development Program, the Aboriginal Infant Development Program, Supported Child Development Program, and the Aboriginal Supported Child Development Program. And I'm just going to hand you over to Jason to provide a little bit of research to how we came together for this project.
Thanks, Alison. So I'll quickly just touch on some of the work that was the impetus for this research project overall. Early intervention services in British Columbia don't really have a solid infrastructure to support service providers and working in culturally safe and trauma-informed ways. After many years of advocating for some resources for training, we were fortunate that the government, the Ministry of Children and Family Development in BC, did provide some funding for our association, BC ECDI, to develop a training plan focusing on cultural safety and trauma-informed practice. What we did is we had just developed a program that had 3 phases to it. The first, we hired a cultural safety expert and a trauma advancement from practice expert to collaborate on developing a 2-day workshop curriculum. We traveled the province and delivered 10 of those workshops. So I had more than 250 frontline service providers in the early intervention sector attend. We curated all of the free and accessible resources we could find online and have that available on our website to all those practicing in early intervention in British Columbia. Of course, any and all are invited to peruse the cultural safety and trauma advancement from practice resources available on our website through the link provided in the PowerPoint. And then the third part of our training plan was a champions program. Because there's not an existing infrastructure in BC or a well-established infrastructure to support this practice, we felt it was important to try to develop an infrastructure, and we trained some additional workshop attendees on some knowledge broker strategies, and we bring them together on a quarterly basis to share what they're doing in their own agencies and their own communities to further the training and learning from a 2-day workshop. The training plan overall created a real interest in learning more about cultural safety and trauma advancement from practice. And further, we had some resources remaining to support some further work in this area. And that's when I reached out to Dr. Gerlach and Diana, and we collaborated on the research that you're about to hear more about moving forward. Thanks, Allison.
Thanks, Jason. So education is an important component of really advancing this approach to providing early child development. But unless it's supported by supportive policies, management, funding structures, then it really pushes responsibility and further possible potential tensions and stress down to the frontline providers. So the initiative really galvanized the three of us to approach the Ministry of Children and Family Development, MCFD in our province, the provincial funder of this system, to do this study. And so here are the questions that really guided this work. We're really focusing on provincial organizational level supports, what enhances, what constrains this approach with Indigenous communities, families, and children. And although the focus was on this particular population, what we found is that many of the participants that we engage with were really seeing this approach as necessary and important for all families that they were serving through their communities. And then we wanted to really make the leap and to say, okay, so what can we do with these findings? What are some of the implications for us? So how did we do this research? In 2019, we sent an electronic survey to the workshop participants, 231 of them, who were from a wide range of Indigenous and mainstream early child development intervention programs. And they were at management, but primarily frontline levels. And we received 122 responses. And then from 2019 to 2020, we purposely recruited survey respondents and conducted 7 focus groups so that all regions of the province were represented. And also there was a diversity in terms of different disciplines and programs, and we had a total of 36 participants. And then earlier this year, we hosted 3 knowledge translation and exchange forums, which I'll discuss a bit later. So the focus today is we'd like to share what did we learn, what did we find? Our findings point to 2 key provincial structural constraints. We did not ask any direct questions about funding, but this theme was highly prevalent in the perspectives of participants who are living and providing services in the Northern Health region of BC. One person noted, everywhere is underfunded and underserviced, especially in the north, because we have such a big geographical area to cover and the population is much lower. Also, another participant noted, the wait lists are a challenge for all families. There is so much research around how early intervention can rewire the trauma brain, but there isn't the money to allow it to be implemented. Again, we did not anticipate or ask any direct questions about accreditation, or CARF, which stands for the Commission on Accreditation of Rehabilitation Facilities. Accreditation provides professional standards and covertly governs the routine practices of early child development and intervention practitioners here in BC, and perhaps in your jurisdiction as well. There was an enormous amount of data on participants' concerns about the constraints of existing accreditation standards. One person noted, I don't think any one of our agencies would not want to accommodate families. It's more what we're allowed. It's what the CARF perimeters dictate. And so many of the participants questioned how accreditation could be reconciled with trauma-informed practices. The findings also highlight 3 problematic policies related to appointments, intake, and report writing, which were perceived by many as necessary to comply with accreditation standards. Policies for appointments in a context of high waiting lists and caseloads created challenges. One person noted, we have unfortunately 3 strikes if we can't contact you and we discharge. There are some exceptions, but our ability to follow up is less because of the waiting lists and growing caseloads. Participants also expressed concerns about the amount of paperwork and questioning that was often a routine and expected requirement of meeting a family for the first time. Someone noted, it feels like a very medical start. We have all these forms, we're going to keep track of them and get a whole lot of information. This quote highlights how an initial consent process is not just a formality for many families, especially when the historical context of paperwork and tracking about Indigenous children is taken into consideration, and also when consent involves a discussion about guardianship. Participants also questioned whether they were writing reports for their agency or for families. This quote is really striking, I think, for me. It says, how do you write a report that doesn't take your breath away when you're a parent reading it, and yet still get the information that you need to the providers, or they're not going to get that resource? These findings show how organizational policies can serve accreditation and organizational requirements, but raise questions about their unintended consequences for families. In the current system, Indigenous communities and families are expected to overcome their suspicion and fears of the ministry, which in British Columbia, the Ministry of Children and Family Development, is responsible for both our early intervention and our child protection systems. And it's extremely challenging to create safety from within systems and institutions that many Indigenous peoples and communities associate with trauma. There's also the expectation that families in the North have to do a lot of traveling year round, regardless of the weather and their family circumstances and children's health. For frontline providers, the system expects them to implement a trauma-informed approach off the side of their desk with no additional time or resources, as Jason mentioned, and to figure out a way of having to stat it. That is, how to shift their practices while still conforming to the time statistics required by their funder, MCFD, our provincial ministry. Findings highlight the tensions created for frontline providers who want to be strengths-oriented with families, but are required by the system to often focus on what is wrong with a child, often through screening or assessment, and then report writing. The system also undermines the capacity of professionals to spend time building relationships with families and in rural and northern communities. When focus groups participants were asked, the initial question we asked them was, what comes to mind when you think of trauma-informed practice? Many immediately responded with one word: relationships. Understanding the importance of building relationships and trying to find time to do that relates closely to understanding the impacts of trauma, and it's very challenging to support relational practices as a result of how centres or programs are currently funded, evaluated, and accredited. So what about organizational factors that support the provision of trauma and violence-informed early child development intervention? A recurring theme in organizational factors that support this was the need to look outside of the CARF box, or look outside quality assurance, existing quality assurance standards. One person noted, I think a lot of us trying to look outside the box and do things differently, and we just need to have more time to share that information. Another person noted, yes, we need to get paperwork done. Yes, we need to do these things for CARF, for the ministry, but we also have to think about who are we really here for and what does that really look like? So you can see that there's these tensions between organizational and provincial requirements and expectations, but also what frontline practitioners are really wanting to do and what they feel families could benefit from, and a kind of a bit of a misfit in some circumstances between these two things. So the findings kind of show how participants, they were trying to find ways within a system that pulls them towards a reductionistic medical model, to adapting it in order to provide family-centered practices that are aligned with this approach. One person says, I'm not saying that we're a medical model, but there's still some foundational pieces that are still there. I would say, you know, the way intake is done is an old throwback to that. Another person noted, family-centered, what does it mean to who we serve, as well as rather than just us? It's important to note that within our system in British Columbia, there are programs like Diana's program that she leads, the Aboriginal Infant Development Program, which never started off as a medical model, unlike perhaps our early intervention therapy models did. But the Indigenous programs focused right from its inception on engaging with families and supporting families as their primary focus. Supportive operational policies include having leadership buy-in. As one participant stated, if we didn't have such a supportive executive director, we would be feeling the strain a lot more in our practice, but it's a very healthy work environment. Not only is it key to have leadership buy-in, but it's also key for all staff within the organization to have a certain level of training about trauma and balance-informed care, and for there to be opportunities for ongoing conversations about how to analyze and change taken for granted ways of policies and procedures so that they reflect and are aligned with this approach to care. Being community and family driven also requires that funding formulas and leadership support frontline providers to spend time in First Nations communities, regardless of their rurality. Similarly, spending time with families, as many Indigenous early years providers in this province already know, is key to knowing how to best support the family as a whole. This is summed up in the following quote from a focus group participant, who says, "We are seeing a difference when families feel taken care of in that way, and they feel like somebody's truly listening and hearing what their worries are. Because I mean, I can go in with my own agenda and look at the child and go, oh, I think we need this and this. But a lot of times, that's not where the family is." This quote, I think, speaks to the importance of taking care of the family as a whole as a first step in an early child development continuum of care that does not necessarily start with focusing on the development and health of the individual child. Connecting before collecting highlights the importance of putting the paperwork off and building that relationship first. The sub-themes outlined here also emphasize how a relational process can shift power when the process is not determined by professionals' preconceived agendas and paperwork and accreditation standards, but by families' self-identified priorities and concerns. As I mentioned earlier, this year we hosted 3 knowledge translation exchange forums with early child development leadership and with Ministry of Children and Family Development policy stakeholders to collaborate on the policy and practice implications of this research and explore opportunities to change. And so we're just going to share a few slides that show some of the initiatives that we're currently collaborating with in our ministry as a result of this project. So one of the key things is our project is currently creating a new provincial vision and framework for children and youth with support needs. From this research, we're highlighting that regional tailoring and equitable rather than equal funding for agencies is key, particularly for agencies serving northern and rural communities and families across large geographical areas. Historically in our province, there's been an urban funding bias towards how agencies receive funding, and it really fails to take into account the geographical differences and requirements for reaching rural and northern nations, communities, and families. We're also, Jason in particular, is engaging with the ministry in conversations around rethinking accreditation on quality assurance and the process of quality improvement, drawing on the lens that we use in this research. we're suggesting that quality assurance needs to be informed and engaged through engagement by Indigenous communities, elders, and Indigenous early child development and intervention stakeholders, and by families. There also needs to be a no one-size-fits-all expectations, but the capacity for agencies to tailor their services with and for local communities and families, so that they are authentically community and family driven. In terms of fostering leadership buy-in and knowledge at all levels of the system, this is really key so that everyone in the system at all levels, provincial, regional, community, agency, understand the impacts of interpersonal and structural forms of trauma and violence on all those who have contact with the system, parents, children, and also service providers. This requires leadership buy-in and organizational cultural shifts towards transforming taken for granted standards, discourses, power relationships, policies, and procedures. And so really having the ability to take the time to do this, and also to have the capacity and time and the resources to do this in a way between agencies, so there can be some knowledge exchange between agencies supporting each other's work in this area. Funding is also required to support that knowledge exchange between knowledge Indigenous holders and early child development leaders and providers. I was asked in one of the forums, how would you know if we were doing this approach and it was working? And one of the things that came to mind for me was looking at who is in decision-making roles within your agency. Do you have Indigenous representation on your board? How are decisions being made? Are families being engaged in the decision-making process? Family-centered care is used a lot, and really I think there's a critical need to rethink and recenter how we're thinking about family. Because although there's lots of claims, and we see this in this research around being family-centered, what we can see is that actually sometimes the pull towards meeting accreditation, the influence of wait lists and caseloads and those other structural factors, the lack of funding often, means that we're not really attending to family. We're focusing an awful lot on the individual child. So there's really a call to rethink, and I know we're not the only ones saying this, at organization and policy levels, what being family-centered really means and how services are experienced by all families. There's also this need to adapt policies for families rather than expecting families to adapt to our policies. And this really involves going back to what I said before in terms of listening and learning with and from families and communities. This notion of taking care of families may seem common sense to many of you, but actually it often is again not really supported through the funding, the resources that are available. Family support workers in many agencies in BC have lost their funding. And so taking care of families requires that agencies and providers have the resources necessary, the knowledge and the flexibility to be able to provide wraparound and often connect with and engage with intersectoral supports with parents in supporting us accessing basic needs or other complex systems, such as the adult or pediatric healthcare system, transitioning into the educational system, and navigating the child welfare system. So this really involves listening and spending time getting to know parents so that you can understand and learn what their self-identified priorities are prior to bringing in perhaps our own agenda of focusing on children's health and development. We hear a lot about relationships, about the importance of building relationships, but we actually need to develop and have structural supports for relational practices and for relationship rebuilding, given the history of colonization and cultural genocide in our country. So this notion of connecting before collecting, I think, is a really key one, because it happens right at the beginning of engaging families in a service or a program or an agency. And so we need to have the resources to spend time building relationships with community members in a First Nation and with a child's parents or primary caregivers before we start asking lots of questions or completing all that paperwork. We need to have policies and quality assurance and improvement standards that support flexibility and have the freedom to do that. One of the things that I should mention is that in our province, the accreditation is tied to funding. So every 3 years, when you go through an accreditation process as an agency, it's really tied to securing your ongoing funding from the province. And so some agencies, but not all, are very cautious about challenging those standards because they cannot risk losing any funding. So this flexibility is really needed rather than a one-size-fits-all model for building relationships. And this approach contrasts with a kind of a checklist and an efficiency-driven nature of business as usual policies and practices that are often driven by an agency or provider and funder. In this research, 13% of survey participants and 14% of focus groups participants self-identified as having First Nations or Métis ancestry. So this research did not have the scope or the funding to really engage more fully with Indigenous early childhood development stakeholders or with families or with communities. And future research really needs to be going forwards, grounded in the knowledges of Indigenous elders, families, and children's perspectives and priorities. So that's the end of our presentation. And we're really looking forward to having some time and hearing from you. Thank you.
Well, thank you all for that great presentation. We have a few questions in the question box, and it's my chance to also prompt again, get those questions in there now, and we'll get started. So from Janine, of the 36 respondents to the survey, can you please identify how many were per region and program?
Yeah, so in the survey, the 36 participants, thank you for your question. The 36 participants were actually the focus group participants. And what we did is we did a focus group in each region of British Columbia. But because there was so much interest, the most interest in our research was from the areas of the province that had the highest percentages of First Nations and Indigenous communities. And so that's the northern region of BC, Vancouver Island, and the interior. And we ended up doing 2 focus groups in the northern region because there was such a huge interest in these issues and these concerns from that region.
And Janine, if you have any follow-up to that, just type away and we'll pose some more probing questions. Another question, how do you intend to involve the mainstream supported child development and infant development regional advisors who are organizing and providing training for those programs so they can ensure that they too are providing said training in the ways that support the objectives you're trying to achieve?
Do you want to, Jason?
Yeah, I can maybe address that. I mean, and we're getting a bit in the weeds on BC specific programs. One of the challenges in British Columbia is that we don't have a real infrastructure around early intervention services, as I alluded to earlier. And we have all these community-based agencies that are nonprofits in contract with MCFD. So it's a real challenge to develop an infrastructure to make sure that all our service providers receive this training and updating on the training on an ongoing basis, which should be the case. So the limited amount of funding that we were provided in 2019 provided this workshop and this research. We've been doing some ongoing advocacy work here in British Columbia to try to make sure we can have this training be ongoing basis. There's some nice resources developed through the Provincial Health Services Authority in British Columbia that are specific to cultural safety practice that we're trying to make our MCFD contracted agency colleagues have available to them as well, because it's a real you can't build and change and evolve service delivery from here's a limited amount of money and you have 1 year to develop and deliver this training plan, it obviously has to be something that's cemented and part of ongoing practice and training. So in terms of the various programs in British Columbia, we were limited with the funding we had to deliver the 2-day training programs, and a lot of the and the survey and the focus groups really were born out of that, and the 255 folks that attended those programs. But clearly in British Columbia, we need to work with our ministry colleagues on developing an infrastructure so that all programs are aware of and sharing their learning and practice changes that can be implemented through this work.
Thank you, Jason. One question about, can you share the link to the trauma and violence informed care resources that you listed? Perhaps typing them in the chat box if you're able. Another comment, thanks so much for this important work. I understand that the MCFD or CYSN is undergoing some revision, but it feels like a bit of a black box right now. How can we ensure that this type of work informs those revisions?
Jason and Diana, do you want to talk about the work that you're doing related to with MCFD?
Sorry, I was searching, cutting and pasting. So, in terms of the ministry, there's a couple of interesting things that are working as a direct result of this research. I also alluded to it a little bit in terms of accreditation. We've had several meetings now with quality assurance folks from the ministry, and as well as representatives from CARF Canada. So CARF is the national accrediting body you may all be aware of. And we're working at, first of all, I think CARF has a lot of work to do to make sure their standards are viewed and reviewed through an Indigenous lens. But in the meantime, we're looking at some short-term work where Indigenous-led agencies that are accredited through CARF Canada share do a workshop and share some of their things like intake procedures and practice with non-Indigenous led agencies, just so that some of our non-Indigenous led agencies can learn from Indigenous led agencies as to how they meet accreditation standards but still work in more culturally safe and trauma and balance informed ways. So we're pretty excited about that work over the next year. The ministry itself right now is in the middle of a new CYSN service framework so children and youth with support needs service framework. And we're in the middle of the final throes of the sector being able to provide a little bit of feedback and input. There's a Ministers Advisory Council has been developed, and myself and Dana Elliott sit on that council. And we have a really good opportunity there to influence and inform the CYSN service framework to make sure that the way we practice moving forward is in a manner that better meets the needs of Indigenous families and communities. And I think as a final example I'll give before I stop talking because I'm rambling on, I'm sure Dana has plenty to add, is the whole issue that Allison raised around stats and how service providers stat their time. And right now we have a real narrow definition of what the ministry considers to be direct therapy. And folks, it's really voice to voice and face to face, and it does not in its current format allow these service providers to develop and build the relationships with the Indigenous communities that they serve, to build that trust, build that relationship, and then be able to better support families in Indigenous communities. So we're doing some work again with the ministry on looking at how they define the data elements that folks have to report on, like contract deliverable reportables, but making sure that what we're reporting on is reflecting the real type of work that has to happen on the ground, and that work is valued and is being, and whereas now the way the stats are, that kind of work that needs to happen is really inhibited by the existing structures. So hopefully that helps address that question.
Go ahead, Diana.
I was going to say the only thing I can add is I agree and acknowledge with everything that was just said. AIDP has always been community-based, community-driven, and community-paced. So I always talk about time. Time is relative. And I think part of a lot of issues is we really aren't family-centered practice when we worry about our own timelines, our own constrictions, all of those things. And I think there's always been a lot of, sorry. Here. Oh my God, I'm sorry. Here,
Don't you worry, it's COVID. Lovely little faces are a delightful interruption.
Diana wears many hats, including
Yes.
being a grandmother during the day. Don't worry, Diana, she can join us, Diana.
Yeah, she could.
I am so sorry.
Don't you worry.
That's one of the reasons I couldn't make a meeting last week. Now she's going to cry. Okay, where was I? Oh, we're constantly compared to mainstream programs, and we're not seeing as equal or even just different. So I think the only thing I want to add here when we're talking about all of the structural supports and trauma-informed and violent-informed practice is the system is traumatic. So I just want to say that when there's so much criticism and comparing, I just want to point out for us to be seen as a program that needs to support Indigenous children and families. So I just, what I was hearing through some of the questions and some of the presentation is I'm just going to stress that there needs to be change. I mentioned the Kamloops Indian Residential School in the beginning. And, I recently had someone ask me if we were creating more trauma because of our policies and because of our practices. And I said yes, because when a child needs an assessment, that's the focus, is the assessment, not the relationship building, not the connecting before the collecting. So I don't know if I'm really answering the question, but to also say that the new framework is a work in progress. I am one of 16 members on the MCFD, the Ministers Advisory Council. Jason is also on that committee, and we really are trying to be the voices of our programs, also the families that receive our resources. So in that interruption, all I wanted to say was that for us to look at things from a trauma lens, also look at maybe our policies and our practices being traumatic, because we might be compared or criticized because we do things differently. An example is we might take longer to do an assessment because we're going to build the relationship. When we visit, we literally visit and have a cup of tea, and people have said, oh, it must be nice to sit around and have tea all day. Well, that's not what we're doing. So just thinking from trauma informed, sometimes our Indigenous programs are going through trauma because we're going through a comparison. So I just had to put that out there kind of as where we're coming at. And so the need for the development of structural supports, whether we're working with Indigenous children or not, just looking at the, we're hearing a lot about accreditation. Well, that in itself, very few of our programs are accredited, so we don't go through that same kind of process. Some of our programs that are accredited, it's because the agency's accredited, not because AIDP chose to be accredited. It was part of the agency that is. So I might have gotten lost in trying to answer that question, but I hope I was able to just share some information to sort of help explain a little bit about where some of us are coming from.
Thank you. There was a lot of supportive comments, Diana, for you and the little wee treasure outside your door. Janine followed up with her question around how to communicate with regional advisors at a leadership level, because they're not able to, they're not getting information from MCFD And one suggestion was a distribution list of some sort. Is there a community of practice, either within BC or even nationally, that could help share some of these practices more broadly?
That's a great idea, Paula. Again, the work that we've been doing, I'm a one-man show here at BC ECDI, so the work that I've been doing needs to be focused on just BC ECDI due to the capacity issues that I have. Obviously, in a perfect world, I wish that all agencies were members in BC of BC ECDI, and we had the capacity to support everyone and anyone, but that's not the reality here in British Columbia. But looking at other potential communities of practice, Paula, other organizations that have more resources to build that infrastructure. And again, I think our provincial government has to take the responsibility to fund this adequately to make sure the infrastructure is there. I think a lot of Janine's questions and concerns could be addressed if that's the case. Right now, we have too many small pockets doing great work, and the reality needs to be that we need the entire province and the entire country, united behind evolving practice in this manner. So I'd be really curious to hear from anyone on the webinar and anyone at Children's Healthcare Canada, suggestions they have on other organizations we can reach out to try to help, with the infrastructure piece, building the voice, creating community practice so that we can really help to reach as many people as possible with this good work.
Great. We may have to put our heads together after this and see what we can come up with. There's a couple of comments in the chat box with regard to the F words and incorporating those into practices, but I'm not aware of the Indigenous perspective as it relates to the F words initiative and how it aligns or supports this kind of practice. Do we know if other Indigenous agencies, in this case it's Ontario, are using that framework? And if so, folks would love to connect. Again, there's a lot of interest in connecting on this and learning from each other. According to Jillian, there's some Indigenous partners in James Bay that are using the F word. So perhaps we can, on the chat, connect people, or let me know and I'll help connect. Janine came back, I don't know if you've seen it, Jason, with 300 or more infant development programs and SCD consultants, SCD. It's an alphabet soup of acronyms. Concerns are reflected at the provincial level when it doesn't necessarily include them or their perspective. So I assume that part of what you three are trying to do is ensure that those voices are heard at the provincial table, and in fact making space for them at the table. And Six Nations is looking for some training here. So there's some opportunities to connect. There's another question from Amy, who's a gynecologist in Ottawa and provides care at an Indigenous health center. Just wondering if you've all worked with care providers who offer women's health care or maternal child care.
I can address that if you like. Thanks, Amy, for your question. Great to have you here. I think one of the things that we're, in BC and probably across Canada is that we, early child development and intervention, unfortunately focuses only on the child often, even though it's called family-centered. And so what we know that when we bring an equity lens, which is aligned with a trauma and violence-informed approach, is that you cannot focus on the level of the individual child. You need to look at often maternal well-being, parental well-being. You also need to look at family well-being and families' access to whatever they need in order to be well. Some of the research that Diana and I did a couple of years ago with Aboriginal infant development programs really highlighted the importance of supporting the health and well-being of the primary caregiver as a priority before the caregiver really had the resources and capacity to then attend to their children's health and development. So one of the things we're looking at currently in BC is how do we bridge all of our silos that are structured in terms of, we have the Ministry of Health, we have the Ministry of Children and Family Development, we have the Ministry of Education, and really families' lives don't fall into those separate ministries, and we need to really have a lot more connections to support maternal well-being and family well-being. And I think that's recognized and known. And I think there's a receptiveness to try and address some of those things, but it's definitely a work in progress.
Wonderful. We seem to be at the end of our questions now. So I'm going to give one last chance for any questions to come in. And while I'm doing that, I will thank Diana, Allison, and Jason for a great webinar and some opportunities to connect post this webinar. Thank you for sharing your time and expertise with us and our members. Thanks to all the members and other attendees for choosing to join us. We know how busy everyone is right now, and we hope you'll all depart with some practical knowledge to bring back to your organization. Our Spark Live webinar program is now going to be on a summer hiatus, and with a return to our series on September 8th at 11 a.m. Eastern, when we'll be pleased to bring you Anishinaabe, the Children's Health and Wellbeing Measurement Tool, and resources for Indigenous children. We invite you to save the date for our 2021 annual conference taking place virtually from November 22nd to 26th. And the theme this year is From Crisis to Catalyst, the next chapter for children's healthcare. The call for abstracts is now closed, so we hope you register to join us. It's always great if you watch live, as your questions and comments really enrich our discussions. But if you can't, the recordings of these sessions are made available after the fact on our Knowledge Exchange Network. So thanks again for joining us today. Thanks to Diana, Allison, and Jason for this presentation. And hopefully we'll see many of you back here in the fall. Bye, everyone.